Welcome everyone to tonight's Ford Aeronutronics property meeting for the Belcourt Master Community Association. The Santa Ana Regional Water Quality Control Board is hosting tonight's meeting, and we're going to be discussing the results of the human health risk assessment for your community, as well as the results of the recent soil vapor extraction pilot tests, upcoming next steps, and then answering questions. So just a few ground rules before we get started. As you all heard, this meeting is being recorded so that folks who are not here today can watch at a later date. We'll have moments throughout the presentation where we'll pause and give you an opportunity to ask your questions. And we'll also have time at the end of the presentations. And you can ask your questions a few ways. You can use the chat function that Zoom has, or you can either raise your hand on your video screen or use the raise your hand function on Zoom. And we'll get your question answered. If you have property specific questions, we ask that you just put your contact information in the chat function, and we'll have a member of the team follow up with you directly. So just your name, phone number, and your property address. And then if you have any other questions later on after the meeting, we have the Ford project information line there on the screen, as well as Jessica's contact information. So as I mentioned, tonight's meeting is to discuss the findings from the June 2021 Human Health Risk Assessment for your community, the SVE pilot test results, and discuss next steps and answer questions. You'll see there's a list of various handouts that we've had at past meetings. These are all online on Ford's project website at www.fordnbfax.com, and my colleague Sarah will put that information in the chat for you all. I want to take a moment to introduce all of the people who are here. So my name is John Permani. I work for Craig Communications, and we are a consultant who helps with community outreach on behalf of the Waterboard and Ford and Wood. Giving the presentation tonight, we have Jessica Law, who's the case manager with the Regional Water Quality Control Board. Jessica, if you wouldn't mind raising your hand. And then we also have Amanda Palumbo, who's a toxicologist with the Office of Environmental Health Hazard Assessment. And then from Wood, we have Mike Barnes, who's the project manager. We have Daniela Hamid-Nazaroff, who's the engineer of record. And then we also have Jane Parkin-Coleman, who is a risk assessor who will be kicking us off with the next portion of the presentation. Here's our agenda for tonight. As I mentioned earlier, we will have time in between when we switch from the different presenters where you can ask your questions, or feel free, like I said, to raise your hand or put your question in the chat box, and we'll get that answered as soon as we can. And with that, I'll go ahead and turn this over to Jane.
Yep, great. Thank you, John, for that introduction. And I just want to say good evening to all of the residents and representatives of Belcourt Master. I will be talking about the human health risk assessment for the area. And the risk assessment is an important document, and Wood has a large team of scientists that are specially trained to prepare risk assessments, and that is what we focus on. So as mentioned, my name is Jane Parkin-Coleman. I've been conducting risk assessments for about 15 years. You may have seen my colleagues, Karen or Usha, at other meetings, and they and I are part of the team that has prepared the risk assessments for the Ford Aeronutronics site. So just to introduce some context, a risk assessment is all about the chance of an event occurring. So this is about chance and doesn't represent certainty. Perception of these risks or chances is about choices and behavior, and those vary by individual. So when we conduct a risk assessment, it is to help people in their choices. We do make some risk management recommendations in the risk assessment, but risk management is ultimately the water board's role and is part of what they do. So next slide, thank you. The 4 key components of a standard risk assessment have been presented at the community-wide meeting, but we know that many of you may not have been at that meeting, so we just wanted to introduce these concepts again. Wood has done all of these steps in the risk assessment, and that whole process is what we are reporting on tonight. So the 4 steps are shown here. The first step is data collection and evaluation. This includes deciding which contaminants we are going to look for, and then determining where they are and how much of these are in the environment. So specifically for this site and for the risk assessment, we collected samples of indoor air and soil gas. It's important to note that the more data that we have to put into this process, the more confidence we have in the results. The data that were used in this risk assessment have been collected over about 2 years. The second step shown there is exposure assessment. So this answers the questions of who, what, when, where, and how much for the risk assessment. So the process of evaluating exposure is designed on purpose by regulatory agencies to be protective of human health. For example, one of the assumptions that we make about exposure is that a resident is present in their home for 24 hours a day, 350 days per year, and that they live in that property for 26 years. So the next step is toxicity assessment, and this specifically refers to the numeric criteria that are used to evaluate how toxic a chemical is. So there are toxicity criteria that are related to both cancer and non-cancer effects. Only some chemicals are considered to potentially cause cancer, so only those have cancer toxicity values. All of that information put together, the chemical data, the exposure assessment, and the toxicity values, is used to do the risk calculations. And for those, we estimate both hazard, which is the non-cancer component, and cancer risk, and we do that for each specific residence. Next slide, please, John. So Jessica has also previously presented this slide, which is on risk management at a community-wide meeting. The main message of this slide is that we get a lot of numbers out of the risk assessment, and some of them are related to the chance of cancer or cancer risk, and some of them are based on non-cancer hazard, which are the other health effects not related to cancer. So based on the ranges of those numbers, which are shown here in the left column, we put the results into decision boxes, and these are what are shown in the right column. So when a result is in the red range, agencies like the Water Board recommend that some action needs to occur to reduce those risks. When a result is in the yellow range, we need to determine what to do next. And that usually includes something like additional investigation or monitoring. So when a result is in the green range, it means that the health risk is considered insignificant and no action needs to occur. So these risk ranges that are shown on this slide are equivalent to the risk ranges that have been identified by the United States Environmental Protection Agency, and what US EPA refers to as the risk management range is that estimated cancer risk between 1 × 10⁻⁶ and 1 × 10⁻⁴, and that is what is shown there in the yellow. So I'm going to use this color scheme throughout the presentation to represent each of these particular risk ranges. So next slide, please. This slide presents our approach to developing the human health risk assessment. Our process is consistent with applicable guidance from the various agencies in California, and also with the technical approach memo that Wood wrote and was approved by the Water Board. So as I mentioned on the risk assessment slide, the approach was developed to be protective of human health. So in the risk assessment, we have presented the results in several different ways. So that means that the risk assessment does have a lot of numbers in it, and we understand that this may be confusing. So to help with that, I'm just going to briefly summarize each of the types of calculations that we did. So as a first, which is shown in the second bullet on this slide, we did an evaluation of current risks, and the risks for current conditions are evaluated specifically based on indoor air measurements. So this provides information about what the conditions are at the present time in a particular residence. The main uncertainty with that evaluation is that we don't know how indoor air measurements might change over time into the future. So things that can change over time are, for example, a change in conditions in the subsurface. So the chemicals that are present in the subsurface might move around over time, or your building might change over time, and this could have some effect on the indoor air concentrations. We also assume that you live in your residence for a long time. As I mentioned, that's 26 years into the future. So to account for these potential changes in the risk assessment, we have presented a range of future possibilities that try to account for what could occur in the future. So we evaluated these future conditions risks in two different ways, and this is what's shown in the last bullet. So the future conditions is based on soil gas data, and that's from the subsurface. And these soil gas data are used to estimate possible future indoor air concentrations. The first approach is a default screening approach, and this is based on US EPA's nationwide database. And this is the most stringent approach. The other approach that we used is a multi-parcel wide approach. And that is actually based on soil gas data collected in your neighborhood and other parts of the site. So we use this approach to recommend the next steps for your neighborhood because we think it is the most appropriate and still health protective for decision making. The reasons that we think this are because this approach is based specifically on data collected in your neighborhood. And that data set is larger than the relevant data set that is in US EPA's database. So the nationwide database created by US EPA really only has data from 4 houses that have a similar slab on grade foundation construction that are like those in your neighborhood. So California agencies are currently compiling data from this investigation at the Ford site and other vapor intrusion investigations in California to come up with a more applicable California specific approach for this type of evaluation. Next slide, please. Thank you. So this slide summarizes the risks that we calculated for your neighborhood. And we know that talking about cancer itself is scary, but when we're talking about cancer risk, we're talking about the chance of getting cancer. So the point of this slide is to illustrate how the chance of other events occurring, like say getting struck by lightning or the rolling of a dice, compares to the risk results for the Belcourt Master area. So the colors here are the same as for the cancer risk decision boxes that were on the risk management slide earlier. In the United States, we each have about a 1 in 3 chance of getting some form of cancer over our lifetime. So that risk would be at the top of this chart in the red area and actually higher than the chance of rolling a 1 on a die. So for the current conditions at Belcourt Master, using the indoor air data, we were able to evaluate 3 properties and no houses fell into the red or yellow for cancer risk. And all 3 properties evaluated were in the green. I apologize, it looks like our figure didn't quite get updated. So it should be 3 on the bottom in the green. So the dot that is shown for current risk represents the top of the green range. So the future risk range is shown using the arrows on the right, and that goes from the yellow range into the green range. And as I mentioned earlier, since we can't predict the future, we evaluated a couple different scenarios for each property. So that gives us a wider range of potential risks for the future. So when we have results in the red or yellow, we can do something about that. And that is going to be the focus of Jessica's presentation. So the goal of the next steps after the risk assessment is to move properties from the red and yellow and into the green zone. So next slide, please. So here we have the results of the current conditions evaluation. And so for your neighborhood, we have just 8 homes that are in the investigation area. And as of the point in time when we performed the risk assessment, we had collected indoor air at 4 of those homes. And then at least 3 of those had at least 2 sets of seasonal indoor air data, which is what we needed to conduct the risk assessment. And so all of those 3 properties, the current conditions risks were in the green range. So we can go to our last slide. John, thank you. All right. So lastly, here's a summary of the future conditions risk evaluation. And the figure that we're showing here is figure 9 from the risk assessment report. And this figure also represents the recommendations that we made based on the risk assessment. So just to give you a little bit of perspective, on the figure, we have the outlines of each property, and they're labeled with a numerical ID, which we use instead of addresses to maintain the privacy of the residents. And so of the 8 properties that are in the investigation area, 7 of them are showing here in green, and that represents insignificant risk for the future. The property shown in tan would also be shown in green because it does have an insignificant risk level for future conditions as well. But in this case, the property met the project specific criteria for being offered temporary mitigation. And so that's why we show it shaded in tan. There's a couple of things we just wanted to point out relative to this evaluation. And so the future risk estimates are based on soil gas measurements and not indoor air that you're breathing right now. So these predictions are not set in stone, and they just represent potential future scenarios that we developed and used to make recommendations. So as I said, the green shading here indicates that risks are considered to be insignificant and acceptable for future conditions. The water board is going to use these, these results for the future risk evaluation to make long-term decisions for how to manage the site in a health protective way. So these decisions are going to be made on a property specific basis. So, we collect samples at each specific property. And so we have the information for each, if property is sampled, to make those evaluations. And since the water board is using the results of the wood risk assessment to inform their decisions, they've also had OHSA independently review the risk results, provide their opinion. And so that's what Amanda is going to discuss next. And with that, I'd just like to thank you very much for your time, and I'd be happy to take any questions.
So if you have a question, please feel free to either raise your hand or unmute yourself, and happy to answer them. Okay, doesn't look like we have. Oh, I had a question in the chat come through. Is this the only area in Belcourt that is being tested?
So I don't know if Mike, if you want to take, or yeah, anybody can jump in. If somebody else wants to answer.
Yes, it is. The short of it, yeah, because, and it has to do with that green, that thin green contour line that you see. That indicates, thank you, John. That indicates where there's soil gas exceedances that warrants the screening of buildings in that area. The other areas, there's soil gas probes, and they don't have concentrations that warrant the need for the indoor air evaluation at this time. But those additional monitoring points on here, you see them as those pink squares. They are regularly monitored at least 2 times a year to confirm that there isn't an increase that would warrant some additional indoor air investigation.
Great. And any other questions?
Are you showing the slides on your presentation? I haven't been able to see any of the slides.
Oh, really? Can other people see the slides?
Yeah, I see them.
I can see them.
I can see them.
So we also have the slides available on our website. And I can, if you put your email in the chat, we can email you a copy.
Okay.
So in the upper right, there's some view options on Zoom. I don't know if you can adjust those to be able to see better. But I can go ahead if there's no more questions. So my name's Amanda, and I work for the Office of Environmental Health Hazard Assessment, which we refer to as OHSA, and it's a state government agency. And my organization reviews risk assessments routinely for cases like these. So I'm going to tell you about the purpose of the review and about the results of my review. So I think my slides should be up there. If not, tell me.
Nope, I see them.
Okay. So the purpose of the OHSA review is to check whether the risk assessment is reliable for the project manager, who is Jessica in this case, to use to make decisions about the site. And part of this is ensuring that the health assessment or the risk assessment is health protective. So during the review, I usually check the calculations and the resulting values, and I explain any differences I find. I also check that the sampling data are representative of the exposure conditions and point out uncertainties. For example, if not enough samples were taken. So OHSA generally does not determine if or how risk should be addressed. The process of my review is just about making sure the risks are described accurately. So for my review of the assessment of your neighborhood, in general, I found that Wood followed appropriate guidance and calculations were correct. There were some differences in my assessment. I will mention 3 of them. One is that I calculated a cancer risk that was 3 times higher because OHSA uses a particular factor to protect children from chemicals that cause cancer. Wood followed guidance from the U.S. Environmental Protection Agency and other agencies within California's Environmental Protection Agency on this point. And this is a difference in scientific opinion between agencies, and we see this in many cases. It is a difference that can affect outcomes, but is not a huge difference in a risk assessment. So in your neighborhood, this resulted in 1 home that was in the green being bumped up into the bottom of the yellow in my calculations. So I had 2 in the green, 1 in the yellow. In the big picture, the risks were still low. No homes were in the red. Okay. The second difference is in the way OHSA recommends evaluating future risk. So the health risk might be different in the future if, for example, someone remodels their home or a foundation cracks. And as a result, more contaminants are able to move into the home, which in turn can increase the health risk. So the future scenario is challenging to evaluate because we don't know how events in the future may affect risk. Wood included 3 different calculations to estimate future risk, which is helpful to see different approaches. However, OHSA recommended the more protective approach, which follows U.S. Environmental Protection Agency guidance. OHSA's preferred approach resulted in estimates that were 60 times higher than Wood's 2 other approaches. Again, this is for the hypothetical future risk estimates, not what was measured in your homes recently. I recommended the more protective of the 3 approaches in order to count things that can increase risk in the future. So the third difference is also for future risk, and it was related to the limited number of subslab samples. So those were the samples taken under the foundation of the homes, and they were taken in only 1 location in each home. So it would have been better to have multiple locations sampled in each home, like the indoor air samples. There were also, in general, very few homes that were sampled in this neighborhood. Because of that, I recommended that the regional board consider other data, specifically the soil gas samples taken in roads in the neighborhood for future risk estimates. In other words, I'm just saying to look at all the data available for the area, not just one subset of data. This other data set resulted in higher risk estimates for future risk for some locations. And this recommendation is also typical of OHSA reviews. We often identify uncertainties we feel are significant and recommend a more protective option. So that's all I have, and I'm happy to also take questions if there are questions.
And I just want to note that I put the link to the presentation in the chat box. So if you still are having trouble seeing the slides, you can click on that link and follow along with us. Okay, it doesn't look like we have any questions, Jessica.
Okay, if there are any questions during my presentation, feel free to throw them in chat, interrupt me, that's fine. So before I start talking about our response, I just want to first discuss the area that the risk assessment covers, and those homes are identified on the figure on the right. This is a portion of that northern area of the Belcourt Masters community. So if your home falls in the indoor air investigation area and has been offered indoor air testing, we just really encourage you to get your home tested. And lastly, the risk assessment will be updated in the future as more data is collected. So for the Waterboard Response, we evaluated the results from the risk assessment that would prepared and the comments and results from OHSA's review. And based on that, we considered the current risk and hazard results and the future risk and hazard results for the next steps. So first, I just want to talk about the current risk and hazard, which did identify vapor intrusion may be occurring at one property, but it does appear to be an unidentified indoor air source. I will talk about the current ranges identified on the next slide. And then the second conclusion is just acknowledging the unknown future conditions, such as building modifications and or the degradation of a building foundation that may increase vapor intrusion in the future. So as a result, future risk and hazard calculations are considered in the next steps. And I'm going to discuss that more as well in the coming slides. So now I just want to talk about the results, what the ranges that were calculated mean, and how it informs our next steps. First, just want to talk about the current risk and hazard ranges, which is calculated from the results of the indoor air sampling. And as a reminder, when I talk about risk, I'm referring to cancer risk. And when I talk about hazard, I'm referring to non-cancer health effects. Also, these calculations do assume you are in your home 24 hours a day, 350 days a year, over a 26-year period. So the current risk and hazard ranges are primarily in the green and one home that barely fell into the yellow area, which means for homes that don't have the exceedances in indoor air above the screening levels, those are in the green and there's no immediate response action needed. For homes that fell into the yellow area, that information lets us know that some additional assessments necessary to determine if remediation or mitigation is going to be necessary. And that's where the future risk calculations also help us in determining those next steps. So for future risk and hazard, these ranges were calculated based on soil gas concentrations. And for your community, future risk was calculated a few different ways by both OHSA and Wood. So this first way was considered future risk based on soil gas results from the samples collected just below the foundation of a home. For this community, there was the limited data set of homes that were actually sampled. And of the homes sampled, there was just one sample from beneath the foundation that was collected per home sampled. So this creates some uncertainty with the risk evaluation. And that range, just so you see, sorry there, it's that green up to the yellow. So therefore, OHSA also calculated the future risk and hazard using data collected from nearby soil gas probes located at 5 and 15 feet below the ground. So at the beginning of the presentation, Wood mentioned that they calculated future risk scenarios 3 different ways. And of the 3 different ways, the most protective scenario that they calculated is the way that OHSA prefers to calculate risk. But it's also important to compare the different calculated future risks and hazard calculations to help assist with our future management decisions, future risk management decisions. So I also want to mention that these future risk and hazard calculations are not guaranteed. It's an unknown right now if there will be any change from the current risk and hazard calculations. And that's why we want to do some longer term monitoring and also consider these future risk and hazard calculations in our next steps. So the ranges I want to discuss are from OHSA's calculation. And again, it's the same assumptions with the 24 hours a day in your home, 350 days out of the year over a 26-year period. So first, want to show the future risk and hazard ranges using the most protective scenario, which had results ranging from the yellow up to the red. Then the future risk and hazard using the site-specific attenuation factor, which is just how much does the soil gas concentrations decrease when it goes into indoor air. There's a certain attenuation factor. So that site-specific one ranged from green to yellow. Therefore, the Water Board evaluates all of these future risk and hazard calculations, as well as the current risk and hazard calculations, to determine the most appropriate next steps. So the potential response actions in this case could be additional monitoring, some more assessment, or mitigation. And also, we take into consideration the higher estimation when evaluating risk and hazard calculations. And an example of what we do with the results like this is we want to conduct some additional monitoring of indoor air and the existing soil gas probes, but there's also some additional information from below the ground that we need to help us determine those next steps and determine the final response actions. So from the risk assessment report, we identified the need to develop a work plan to evaluate the source and extent of the soil vapor plume in the Belcourt Master community, as well as the need to conduct some longer-term indoor air monitoring. As a result, the next steps include the submittal of 2 reports, a work plan which had a due date by January 28th, and I saw an email just by less than an hour ago that came through that work plan's already been submitted to us. And then the revised indoor air monitoring plan that was submitted back in July 21st. And we've also recently responded to that as well. So first, I just want to talk about the requested additional assessment in order to better understand this lobe of the soil gas plume in your community. So we requested Ford to collect additional soil gas samples in the vicinity of Belcourt Drive and Cheshire Court, and possibly groundwater data as well. And results from the data collected will be used to further evaluate the need, if any, for remedial action. Then there's the indoor air monitoring plan. So this is a long-term plan to evaluate indoor air to verify if vapor intrusion changes over time. And this is where we would take into consideration that parcel-wide attenuation factor that would develop. A lot of data has been collected from this community as well as surrounding communities, and this is an appropriate way to utilize it. The longer-term monitoring plan will provide analytical data to support whether the current risk and hazard calculations as well as the future risk calculations that would prepared are still appropriate or not. The monitoring frequency will be based on soil gas concentrations and trends, and the frequency of sampling can range from every 6 months to once every 5 years, and Ford will be sending out letters at a later date to notify you of which sampling frequency category you fall into. So that's what I have regarding our response to the risk assessment. And I wanted to briefly talk on the soil vapor extraction pilot test. But before I do that, just wanted to see if there were any risk assessment questions I could answer, or anyone from whether Amanda or Jane could answer. And if you think of any, interrupt me in the middle of this last portion of the presentation, and there will be time at the very end for questions as well. Okay, so now we'll start talking about soil vapor extraction pilot tests that were recently conducted. The pilot tests were conducted at 3 locations: the Bonita Creek area adjacent to Newport North Apartments. It's the Caltrans right-of-way over by the bike paths over there, the Bayridge Park community, and the Sea Island community. And I'm going to discuss the one that occurred at the Bayridge Park community area, since that is located closest to Belcourt Masters, and data from that pilot test location will be used in any future feasibility studies. So before I talk about the results from the pilot test, I just want to provide a refresher about what soil vapor extraction is, which is also referred to as SVE. So this figure is an example of how this type of remediation works. Soil vapor extraction is a remedial technology that can remove vapors from soil above groundwater, and that area is referred to as the vadose zone. So contamination within the vadose zone is removed in the form of vapors through extraction wells, and the vapors are treated above ground, and the cleaned vapors are then released to the atmosphere. Another refresher would be this inlay here shows soil particles and how vapors can reside in between the spaces in the soil. And that's what is being removed from with soil vapor extraction. So a pilot test was conducted in 3 locations, again, the nearest one being Bayridge Park. And due to the close proximity and similar conditions below the ground, that's the one that I'm going to discuss. The pilot test was consisted of 1 location with 2 extraction wells. One was shallow, one was deep. The pilot test ran for a total of 15 days during the day, so about 8 to 10 hours each day. And during that time, nearby soil gas probes are monitored to evaluate 2 main things. First, vacuum pressure to see if and how much effect the extraction well is having. And second, soil vapor data is collected from the extraction well and nearby soil gas probes before and after the pilot test. Data collected during the pilot test was used to evaluate the radius of influence, which I have shown here with this green elliptical. And that's just how far does the vacuum from the extraction well reach, both laterally and vertically. And second is how much contamination is being removed. So first, for the pilot test results, we'll talk about radius of influence, which again is how far the vacuum effect on the extraction well reaches. So industry standard radius of influence of a typical site that would consider soil vapor extraction satisfactory would be a radius of influence of 20 to 50 feet. For the site, the shallow extraction well had a radius of influence of 72 feet, and the deeper extraction well had a radius of influence of 68 feet. So based on those results, this indicates good radius of influence for the area. For the total mass removed, which again is how much contamination is removed from below the ground, industry standards of a typical site suggest that mass removal of 1 pound per day or greater at the start of soil vapor extraction is satisfactory. And during the pilot test, a total of 0.23 pounds total was removed in the 15 days, and that was out of 130 hours of operation. And this is really just consistent with the lower VOC concentrations detected below the ground in these areas. And where the pilot test was conducted, it's important to note that the concentrations in soil gas are significantly higher over there, and that's why we chose that location for the pilot test versus the soil gas concentrations that we are seeing in your neighborhood. So the results of the pilot test would be used in any future feasibility study when evaluating the best remedial approach for the site if it is necessary in your specific area. As I mentioned a few slides ago, the feasibility study takes into consideration the ability to implement the technology, the effectiveness of the technology and cost, as well as acceptance by the regulatory agency and acceptance by the public. So for those of you that were at our public meeting in November 2019, you may remember my analogy of the effectiveness of soil vapor extraction based on soil type. And I compared it to a milkshake versus a slushy. So the milkshake represents tighter, fine-grained soil like clay, which makes air movement more difficult and limited. And the slushy represents a soil type that is more permeable, where air flows easier like sand. So the radius of influence indicates slushy. So the soil type below the ground is favorable based on that particular metric. But the mass removal results indicates that almost finished slushy. You suck on the straw, but you don't get much from it. So in that regard, soil vapor extraction may not be as favorable. And these considerations are important in the feasibility study when determining the best remedial approach for the site. So just to summarize, the risk assessment results support the risk management decisions. The work plan that was due to the water board by January 28th was submitted this evening, and I will be reviewing that soon. Additional information collected from below the ground is going to assist in determining the next steps. And we will be conducting long-term indoor air monitoring to verify risk assessment results and our risk management decisions remain protective. So for additional information, you can go to GeoTracker, which is the Water Board's state database where all of the reports and analytical data and information has been uploaded. There's LIRIS list, which is the Water Board's email notification list, and we can let you know of the next public meeting, the larger public meetings, which the next one will be February 3rd. And there's a Water Board webpage specific for this project on the Santa Ana Water Board's website. Then Ford has a site-specific website and an 800 number. And there is a local information repository at the library. So that concludes all of the presentations for this evening. So I know we have about 15 or so minutes and can answer any questions you guys may have.
Just as a reminder, you guys can unmute yourself to ask your questions. You can type it into the chat box.
Do you have any questions?
So I don't have Doug or Bob, do you have a question or?
And if you think of one at a later date, you can always reach back out to us and we'd be happy
Yep.
to connect and answer any questions you may have, or if you have an individual question with respect to your property and the human health risk assessment, we find it more appropriate to have that conversation offline because there's a community event that's being recorded. So we can also set up a meeting to talk with you individually.
Good.
And I believe Sarah put the 888 number in the
Yeah.
chat line.
Sarah, if you wouldn't mind putting it in just again, that's the best way we can get you in touch with the appropriate people to answer any property specific questions.
Yeah, sure.
And just to confirm, everybody knows how to access that chat function. It's just down at the bottom. If you put your cursor at the bottom of the screen, a chat function will come up. If you click on that, it'll open up all the communication chats that we've had.
Just in case too, I'll just read out the number. It's 833-949-3673. That's 833-949-3673. And that's Ford's informational hotline you can call if you have any property specific questions or if you think of questions at a later date.
And then if you want, this is Jessica, and my phone number, it's another way to contact. If I know some people like the 800 number and others want to call the regulator instead, that's 951-782-4381. So a couple different numbers.
All right. Well, I'm not seeing any other questions come through. So I'd like to thank everyone for taking time out of their evening today to be with us this evening. And if you have any questions, please feel free to give us a call on one of those numbers, and wish you all a wonderful evening.
You too.
Thank you for joining.
Thanks.
Bye, everyone.
Bye.
Thank you.
Bye.